Good evening, everybody. Thanks for tuning in. So my presentation is going to be covering how you manage the injury risk factors in runners. So just a little bit about my background before I start. I work as a strength and conditioning coach in the sports medicine department, or I'm lead clinician for foot and ankle rehabilitation stream, and also lead our run lab services. I'm also undertaking a PhD in Achilles rehab and lower limb biomechanics, and I'm accredited strength and conditioning coach with the UK Strength and Conditioning Association and the Sport Ireland Institute, and also Athletics Ireland Level 3 endurance coach. And I've also had a background in athletics for the last 2.5 decades. My previous career as a race walker, where I competed internationally at European, World and 2 Olympic Games, and retired after the London Olympics in 2013. And since then took up running as a means to still enjoy keeping fit and taking part in competitions. I suppose it still gives me a feel for the sport, and I work a lot with runners as well. So it's good to have that little bit of a connection. So the outline of the webinar will be looking at the biomechanical demands of running, how that might affect injury risk. We'll discuss some of the common running injuries. Now, again, you will have heard from Dr. Carolan and Mr. Jackson on some knee pain and knee injuries, and Dr. Carolan will cover plantar fascia pain. So again, I'm just not going to touch on those too much, but I'll discuss some of the other common ones. And we'll also discuss the role of strength and conditioning as a means of managing running injury risk factors. So most systematic reviews of running injuries and where they occur show that the knee has the highest, is the most common injury site for running related injuries. So in the most recent systematic review in 2018, 28% of running injuries occurred at the knee, 26% around the foot and ankle area. But the main thing you can take from this is that most running injuries, so probably about 2/3 or 70% of running injuries occur from the knee down. So there's probably a message in that in terms of the biomechanical demands of the lower leg, and how we might maybe try and condition that in our strength and conditioning program. So with running biomechanics, there's basic physics involved here. So when we run, when we strike the ground, it's like a collision with the ground, and the ground sort of gives us, or the earth gives us a force back that goes through the body. So it's like Newton's third law. So for every reaction, there's an equal but opposite reaction. And if you look at the example here, so if you imagine you're running over a force plate, as in this video here, you'll see that the force increases throughout ground contact. So if I play the video, you'll see foot strike. And if you watch the green line and watch the cursor move up, so there's the initial peak as the ankle sort of decelerates the initial impact, and then there's a second peak as the force peaks as the foot's under the hip. So if I was to stand, or if you were to stand up, your body has to be able to produce force or experience force more than your own body weight in order to not fall over. And if you want to walk or move forward, that force is going to be 1.5 times body weight. And if you jog, it's going to be twice body weight. And if you're running at a steady speed, it's going to be 3 times body weight. And sprinters at max speed will be hitting maybe 5 or 6 times body weight. So the faster you go, the more force, more ground reaction forces you've got to try and cope with. And the more force you've got to try and produce to be able to accommodate that and to propel the body upwards and forwards. So I talked there about that's what the external force that goes through the body. Well, as I said, in order to cope with that, there's internal forces that are going on, and there are lever systems at play here as well. Because when the force goes through the body, our center of mass lowers, our knee joint and our ankle joint bend as those forces increase. And that's going to put a big demand on some of the passive structures like our tendons, our ligaments, our cartilage, and so on, while also requiring efficient muscle contractions. So again, if you look at the picture here of Mo Farah in a 10,000 meter track race, you'll see that the red arrow is indicative of the vertical ground reaction force direction, so it goes upwards through the body. And as I said, depending how fast you're going, that can be 2 times body weight. If you're jogging, that can be 4 times body weight if you're running at a steady state speed. But the force going through the Achilles tendon as it stretches, so the calf muscles contract and the Achilles tendon stretches, that can be 6 to 8 times body weight, again depending on the speed. But the contact forces at joint level, so at the ankle joint, that's 10 to 14 times body weight. That's like a suction force where you've got bone on bone contact, and that's where the cartilage comes into play to try and help to shock absorb that. So higher joint contact force at the ankle, a little bit less so at the knee, but still significant. So 7 to 11 times body weight. And at the hip, something similar, 7 to 11 times body weight. And again, at the hip joint, being a ball and socket joint, it's like a suction force. So again, it's important that the muscles of the lower leg and from the torso down are conditioned to be able to accommodate that efficiently. But what about bone loading? So we would traditionally believe that impact causes increased bone loading, and it does to a certain degree, but the peak bone loading actually occurs during the mid-stance phase. So again, if you look at Mo Farah there in that sort of mid-stance point where his foot's under his hip, his knee is bent as much as it's going to bend, his central mass is at its lowest point, his calf muscle contractions are at its greatest. That's when peak bone loading occurs, particularly in the shin, so around the tibia. So it comes much later than after initial impact. So it's not just the impact, it's how you kind of absorb that or dissipate that as your center mass lowers and as your joints continue to flex and as the force goes through the body. So I guess if you ask the question, why do most running injuries occur from the knee down? Well, we know from a lot of studies looking at muscle recruitment and muscle force contribution at different running speeds, we know that even at jogging speeds, our calf muscles are operating at about 80% of their muscle capacity, of their peak force capacity, whereas the quads might be operating more around 60% of it. But if that capacity is low, it doesn't take much for that muscle to fatigue earlier than it should do. And a fatiguing muscle is going to affect how the force is distributed and how it's absorbed. So that's going to cause problems locally. So that can put a lot more load through the Achilles tendon. It can cause a lot more loading around the ankle joint. But also, if the lower limb gets tired, if the ankle area gets tired, those forces tend to shift up towards the knee and around the hip. And that can have a big factor on how the knee is loaded and how the hip is loaded, and perhaps increasing the injury risk on those particular sites. So we can safely say that when we jog, our calf muscles are pretty much our jogging muscles, and particularly our soleus muscle, that deeper calf muscle that it has quite a high contribution to running. So I suppose when you think about running and we look at S&C programs, there's a big emphasis on training the core, training the glutes and so on. And yes, that's important, but we often neglect the calf muscles, which is probably the biggest, probably more important if we're to prioritize things. But as I said, it's probably the most neglected area. So if we just look briefly at the calf muscles, so again, if you look at an MRI image, so if I was to take a slice of my leg from the knee down and look downwards at it, that's what I would see. So the LG and MG, so LG being your lateral gastrocnemius muscle and the MG being your medial gastrocnemius muscle. So if you look at someone behind with a bare leg, you'll see those two bulging heads of your calf muscles. And that's, as I said, that's your medial and lateral gastrocnemius muscle. So again, big muscles, quite a big volume. But if you look at the layer deeper than that, the soleus muscle, it's an even bigger muscle. So it is more than twice the volume of the lateral of the medial gastroc muscle. But when you take into account its short fibers, so again, if you look at the image there on the right, you'll see those short fibers that kind of run at an angle between the borders of the muscle. It means that more fibers can be packed into a volume of muscle, and more fibers means that more force can be produced more efficiently. So it's got a bigger force. It's got a bigger force contribution or bigger force potential. And again, so it allows more energy to be loaded on the Achilles tendon as it stretches, and more energy to be, I suppose, returned efficiently. But the calf muscles are also slow twitch muscles, predominantly slow twitch fiber muscles. So they can produce those big forces, but they can do it over and over again, and they can be less fatigable than, say, other muscles that are more fast twitch dominant. So it's really important that we train the calf muscles to produce those big forces and to be able to recover quickly and to be able to repeat it over and over again. And I said, when we're lacking muscle capacity in the calf muscles, that's when we got issues. And then if we see someone coming in with a lower limb injury, it's probably one of the most important areas that we assess. So if you look at some of the common running injuries, we've got runner's knee, which can be an umbrella term for a couple of different knee pathologies, but most commonly patellofemoral pain syndrome, Achilles tendinopathy, shin splints, or any type of bone stress injuries of the lower leg, calf muscle strains, but again, that could be applicable to hamstring muscle strains or quad muscle strains, plantar fascia pain, and proximal hamstring and gluteal tendinopathy. So they're quite common running injuries. So if we look a little bit at runner's knee, and again, I'm only going to touch this briefly because Mr. Jackson will cover this area in a bit more detail, but the knee joint, being primarily a hinge, is not designed for massive amounts of torsion or rotation. And in order to control that, so again, what you have is an overload to the patellofemoral joint. And that could be a combination of a number of factors. It could be biomechanics, it could be how you recruit your quad, hamstring, and hip muscles in particular, and also the muscle capacity of the calf muscles below it. So when we look at a knee injury, we always assess above and below the area. So the calf muscles below and even around the ankle, and above it, we assess the quads, the hamstrings, and the hip muscles. So again, they're quite important. And particularly the quads, particularly the hip, the lateral hip muscles, so your hip abductors, so your glute medius and part of your glute max has a role to play in terms of controlling hip internal rotation and hip adduction. And also your lateral hamstrings, your bicep femoris has a role to play as well in controlling internal rotation of the femur or the hip and adduction and controlling that sort of rotation around the knee joint. So there are areas that we would assess, and certainly if we see weaknesses or deficits in those areas, we chase after them in terms with a rehab program. But in terms of running biomechanics, and I'll show you a video in a few slides time, we'll also look and see what the knee control is like when you're running. So look at someone from behind and see does the knee keep rotating inwards, and that might give us clues as to their ability to control those rotations from the hip down and from the ankle up. So Achilles tendinopathy is a common one that we see, and again, as I said at the start, it's the main focus of my PhD. So some of the common risk factors for Achilles tendinopathy, we can separate them into intrinsic or internal risk factors and extrinsic risk factors. So internal risk factors being calf strength. So for people who have poor calf strength, there's been some studies to show that some of them have gone on to develop Achilles tendinopathy. If you've had a previous lower limb injury, now that could be a calf strain, it could be an ankle sprain, it could be a stress fracture of the lower leg, that can alter the recruitment pattern of your muscles, and that can, I suppose, change how the tendon is loaded over time. So if we have a previous lower limb injury and we haven't fully rehabbed it, but we've got back running and we've kind of cut corners, that can put us at risk of developing Achilles tendinopathy. People who have any type of metabolic disorder, people who have diabetes or a risk of diabetes or of poor cardiovascular health can be at risk of developing Achilles tendinopathy, because tendons it's actually quite a metabolically active organ. So they can be quite sensitive to other things that's going on around the body as opposed to just running. So if you look at some of the external risk factors that are associated with this injury, training load, so a big increase in volume or particularly intensity, and that's quite relevant given the last 15 or 16 months with our COVID restrictions and people maybe exercising more than normal because they're working at home and trying to keep fit, or in elite sport where particularly in collective team training and field sports has been curtailed for several months, and in the last 2 months they've got back again where the training intensity in particular has increased exponentially. That can put people at risk of developing Achilles tendinopathy. Cold weather can be a factor, biomechanics can be a factor. If you had a recent course of quinolone antibiotics, that can put people at risk of developing Achilles tendinopathy in some cases. And also alcohol intake is also associated with a risk of developing Achilles tendinopathy. So again, without going too deep into anatomy here, just use this picture just to illustrate the difference between a healthy tendon and one that has tendinopathy. So tendinopathy is pretty much pain and impaired function in the tendon and the Achilles tendon in this case. So again, what causes pain and impaired function? So in a healthy tendon, as you see there, you got a nice orderly alignment of collagen fibers. So you got it at a very, very small level, and each fiber is kind of wrapped around by a sheath. And between those fibers, you've got little cells called tenocytes. And those cells are sensitive to any changes in load that the tendon undergoes. So when it experiences fatigue or when it experiences big strains or fast movements, those tendons can become more active, and they can react and cause, I suppose, a cascade of events that can change the structure and the makeup of the tendon. So when the load has been too much and the tendon hasn't had a chance to remodel and adapt to that, you've got a change in the composition of the tendon. You've got more type 3 collagen fibrils as opposed to type 1. So type 1 being good collagen, type 3 being unhealthy collagen, or not so unhealthy, but it's collagen that's not able to withstand sort of elastic strains. You've got those cells become a lot more disorganized. They lose that sort of elongated shape. They become more rounded, and you've got molecules that attract more water, so it gives the tendon a more of a swollen or puffy feeling. And then you've also got an ingrowth, especially when the tendinopathy has become chronic. So if it's been going on for several weeks, if not months, you've got an ingrowth of nerve, of blood vessels that normally don't reside within the tendon fiber. They're normally sort of in the space between them, and they tend to migrate inwards, and they leak chemicals that can cause the nerve endings to become more sensitized, and that can give you your pain feedback. And over time, the tendon can sort of degenerate and become more and more deconditioned. So tendons need a stimulant. So total rest is not the answer for treating tendinopathy. We need to try and find a level of exercise that you can do that's not too sore and try to progress it on accordingly. So tendons like a regular bout of loading. So they like to be weight bearing, they like to have the calf muscles contracting, and they like to have a little bit of strain, around about 6%. So again, this little graph here illustrates what can happen if we are exposed to too much strain and too much loading, or too little. So too much, you develop little sort of micro tears in the tendon, and the cells become more reactive, and it can become more catabolic. So it kind of degenerates, eats away at itself, and it's not able to adapt to that load if it's not given time to do that. If we rest for too long and we don't expose it to enough strain or enough loading, again, the tendon sort of, you get a bit of wastage in the tendon, so it becomes more catabolic as well. It becomes less able to handle regular exercise. So it's important to give it that sort of regular bout of loading. And even when it's sore, we try to find a level of calf exercises that they can do without being too sore. So a small amount of pain is okay, so long as it doesn't worsen as we increase our exercises and increase our running load over time. So a little bit about muscle strain injuries. So, you know, we think of a calf tear or a calf strain or a hamstring strain, and we think about the muscle. But in fact, usually in these cases, you have a tendon tissue that surrounds the muscle, and tendon tissue in some muscle compartments that goes down the middle of it. So like a feather. So you see the example there on the left. And usually the muscle strain occurs close to where there's tendon tissue. So usually where the muscle fibers in the tendon sort of meets, at the muscle tendon junction, or usually there can be a tear within the tendon itself around the muscle. And that can have an impact on the grading of the injury and the prognosis of the injury. So if you've got a tear, say for example in the soleus muscle in the central tendon, so again if you look at the illustration B there, that can take longer to recover than say if it was just a muscle fiber tear. Whereas if you had a small muscle tear that's just the muscle fiber, even if it's close to the tendon, but if it's only the muscle fiber and there's no tendon tissue disruption, that can recover a lot quicker, and you can have less disruption to your training. So it's important that we're clear in the diagnosis. We use MRI imaging to know the grading of the injury, whether it's a 1, 2, or 3, or worst case scenario 4, and whether it's just pure muscle fascia fiber, or whether it's muscle tendon junction, or whether it's pure tendon tissue that's disrupted, and that can impact on it. So again, if you look at the calf muscle on the right hand side, you'll see a cadaver image of the muscle. See the soleus there being stripped off, and you'll see the two heads of the gastrocnemius, so the lateral and medial head. But if you look at the white tissue there, that's on the image, that is the tendon tissue, the aponeurosis. You'll see different, I suppose, segments of white tissue around the muscle, and that's the tendon tissue. So again, usually close to those sites is where the injury occurs. So what about bone stress injuries? So essentially what we know from people who have looked at, we've studied both bone loading closely in response to exercise, and those who've developed either shin splints or stress responses to the bone, or a stress fracture. There's usually like a failed healing response in the bone. So when we do impact type stuff, when we run or hop or do something that has high impact, we're temporarily breaking down bone tissue, and that gives the bone tissue a stimulus to recover and remodel. So we're constantly exposing it to repetitive stresses and strains, small little bits of micro damage that occur. But again, in normal situation, if you've got a good healthy metabolism, if we have a good structure to our training, we've got enough time to recover quite quickly to that. But if we're not able to adapt to it, and the bone needs more time to adapt and remodel, and they haven't got a chance to recover, well, then we're putting it into mechanical fatigue territory, where then you're at the risk of injury. So basically, you have, I suppose, failed healing response in the bone. And if you look at what happens within the bone, so when we stress the bone, we have formation of osteoclasts and osteoblasts. So osteoclasts is where almost like where the bone sort of eats away at itself, and that sort of allows for calcium and other important minerals to be released. It also prepares the surface of the bone where the injury is, or where the microfracture is, to be ready for new bone to form over that. And then you got osteoblast formation, which is where new bone cells start to form, and the bone starts to line up again. So essentially, when we have a failed healing in the bone, we have more eating than say replenishing. So it's in that sort of energy deficit. So it's important that when we look at people with bone stress injuries, that we have good nutrition intake. So bones need energy to recover, and that we have good strength and muscle capacity in the lower limbs, because that impacts how bone is loaded, and that we are not increasing our training loads too much too soon. So if we look at a few common factors related to running injury, so basically we have a mismatch between load and capacity. So the load we're putting on the body is greater than our capacity to handle that load. And it's a very, very simple way of looking at it. I know there's a lot of, it's very hard to say there's one thing, but there's an interaction of a number of factors. So obviously we try to look when we assess someone, we want to identify any potential overload factors, and then we also assess their capacity. Some of those overload factors can be biomechanics, it can be training load, it can be changed to where you normally train, and it could be non-training stresses either. So if you have a busy work schedule, busy family life, all those things can be an extra load in the body, or a poor night's sleep. If you have, if you look at capacity on the other side of things, that can be poor muscle capacity, high sensitivity to changes in training load. Some people are more sensitive than others. People who are fitter have a higher capacity. People who are less fit have lower capacity to handle training load. And fatigue, similar. So if you have more fatigue, your capacity is reduced. If you have a previous injury, particularly lower leg injury, you're always at a risk of re-injury because your capacity can be reduced if your rehab wasn't fully complete after that injury. And training age probably comes along to fitness as well. If you have a higher training age, i.e. running for longer than someone who took up running last year, you're going to have a greater capacity to handle those training loads. So this is a nice little graph, and again, I'm not going to go through every little thing in detail, but there's a few little relevant points here. So basically what they did was they were able to quantify the loading of someone who runs, an elite runner, who runs a 10K when they're fresh on an easy day, runs a 10K when they're very, very tired. So they're a little bit slower. So the pace is about maybe 25 or 35 seconds per kilometer slower when they're really tired, versus doing 10 1K intervals on the track in spikes. And the main things here, the difference between being fresh, doing an easy run when you're fresh versus when you're very, very tired, your step count can increase by up to 13%. So you have more time on your feet, more steps. If you look at the accumulated vertical ground reaction forces, that is a 6% increase. So just because you're going slower for the same distance, the accumulated loading can actually increase. So you have more of a step count and your accumulated forces have increased. And look at the Achilles tendon further down. Again, running slow when you're fresh, but running even slower when you're tired, that kind of a 5% increases in Achilles tendon forces. So the main message I would take from that is that running longer and slower when your body's tired, for some people, can be a risk factor. So just important that we maybe, when we're on an easy day, that we just keep some sort of a control on the total volume of running, or the duration of your run. So it might be just better to have your easy runs shorter, particularly when you're tired. And if you're an injury prone runner, for people who are well trained, people who are trained at a high level for a good number of years, they can probably handle that better. But for someone who maybe is more injury prone or has a high risk of injury, just got to be careful in those days, because that's when the damage can be done, because we're not giving the body the best chance to recover, because we're adding more load to it. So some of our common assessments when people present us with injuries or want to try and manage their injury risk factors: we assess strength, we assess their power and plyometric ability, and we also look at their biomechanics, the running biomechanics or running gait. So when we're assessing strength, we want to get a rough idea of whole body strength. So if someone does a squat, whether it's a back squat or front squat, we like them to be able to get to a point where they can put the equivalent of their own body weight or more on the bar and be able to squat 3 reps as a minimum. But again, if someone hasn't squatted before, we're not going to start them on that. They need probably a year or two of just basic conditioning to get up to that. But that's when they get above those thresholds, that's probably a good level to be at. And similarly for deadlift, deadlift will probably target the posterior chain muscles, the hamstrings, glutes, a little bit more than the squat would, depending on your technique and how you coach it. And you can always lift a little bit more. So again, we'd be looking at 1.2 times body weight or more for 3 reps. And if you look at calf strength, what we often do is measure them on a force plate. So we get them to stand on one leg with the bar sort of compressed over the shoulders, and basically they try and push. They try to do a calf raise, but the heel hasn't got space to lift. And we would expect them to be able to produce force that's more than 2.5 times body weight. As I said, the calf muscles are big force producing muscles. They can produce those forces. They need to cope with those and a lot more in running. So that gives a measure of all the calf muscles. But again, we've got 3 calf muscles: our medial gastrocnemius muscle, our lateral gastrocnemius muscle, and our soleus muscle. So because the gastrocnemius muscles cross the knee, so when you bend the knee, that's going to impact how much force they can produce. So when we bend the knee to 90 degrees, we're kind of damping down the force contribution from those gastrocnemius muscles. But because the soleus muscle doesn't cross the knee joint, it doesn't matter whether it's straight or bent, it's going to produce the same force anyway. So if we want to get a rough idea of the soleus muscle force contribution, we'll do a seated calf isometric test where they sit on a seat with their knee at 90 degrees and their heels slightly dropped with the top of their foot on a block. And we get into a seated heel lift where the knee is compressed down and see how much force they can produce. And we like to be seeing people hitting above 1.5 times body weight. And for elite athletes, we try and get them up close to twice body weight. And if we want to get a good measure of their calf endurance, being able to do single leg calf raises, more than 25 of them in 50 seconds. So one raise every 2 seconds with good height and good technique and good control. And if you look at reactive strengths or their plyometric ability, we might test them doing a drop jump where they'll maybe drop off a 20 to 30 centimeter box height and try to rebound in less than a quarter of a second and try to achieve the height of the box that they dropped off or close to that. Or we might get them to hop on one leg and be able to do 10 hops on one leg while maintaining the time on the ground per hop in less than 0.28 of a second, without bending the knee too much. So try to use your ankle to hop. And when we look at running biomechanics, we can get a 3D model of someone running, so we can put some marker sets on them. We've got cameras that give us sort of a 3D capture of them. And when they're running, then we can create that sort of stick man image of them. We can work out how much movement occurs at the ankles and the knees and the hips, how much torso movement is going on, and we can look at some of those rotational movements that I talked about at the knee and the ankle. So again, some of the key things we look at here are hip and pelvis motion. So how much hip adduction and internal rotation occurs. Is there a pelvis? Do they have a forward pelvis tilt that increases throughout the stance phase, or does their pelvis drop on one side if you're looking at them from behind? We also look at thigh and shin rotation. We look at the motion of the heel. So can they control their pronation fairly well, or do they collapse and show poor control, which might cause more loading around the foot and ankle area. And we'll also work out their contact time, their flight time. So basically the time on the ground per foot strike and the time in the air and their ability to handle, the ability to control how much the center mass drops and how much the knee bends as force goes through the body. So it's a measure of spring stiffness. So why do we do that? So again, some studies have shown that there are certain features associated with common running injuries. So this study in the UK looked at, so in the side view, people who tend to lean forward a little bit more, people who present with some common injuries tend to lean forward a little bit more, land with the foot a little bit further in front of the body, so the shin at a bit more of an angle and the knee a little bit straighter. So if you look at the illustration A there on the left, versus those who are not injured tend to be a bit more upright through the torso, land with more of a bent knee and the shin a bit more vertically aligned and the foot closer to where the hips are. And if you look from behind, again, give an example there of hip internal rotation and adduction as well as pelvic drop. So if you look at the athlete, the female athlete in the image A there, you'll see a little bit more drop of the pelvis. So you see the horizontal line going from right to left, a little bit more tilted. And you see the line from the side of their hips to the center of the knee, a little bit more angled. And that can cause more torsional loads at the knee. It can cause a lot more, puts a bigger demand on the hip muscles, but it can also have a knock-on effect around the foot and ankle too, because if the knee has to, if the hip internally rotates and adducts, and you got that rotation going on at the knee, then there's going to be more adjustments of the tibia over the ankle and so on, and all the foot and around the foot area as well. Versus athlete B, who's able to have a more horizontal pelvis position and less of an angled line from hip to knee. So when we prescribe strength training, some of the most important things we try to cover are some sort of a jump or hop exercise. Depending on the time of year and where they're at in terms of the training program, mightn't be done from the start. Having a double leg whole body exercise like a squat or deadlift, a single leg whole body exercise like a step up or lunge or some variation of it, having a calf exercise in there, particularly at certain points of the year to try and improve calf muscle capacity, and some sort of a trunk control exercise to try and improve torso control. So in terms of the qualities we want to try and train, if we're trying to improve power or plyometric ability at a high intensity, we'll keep the reps short. So we don't want to be doing these long enough where they're going to get tired and where power diminishes, otherwise we're not training the right things. So reps of about 3 to 6 reps, for 4 sets, taking a longer recovery between sets, because when you do something explosive, you drain the batteries quite quickly and your body needs a bit more time to recover. If we want to try and improve sort of power or reactive strength capacity, we might dial back the intensity a little bit, go for more duration, so we can work up to 20 reps depending on what we're trying to get out of it. If we're trying to improve strength, we'll do rep ranges between 3 to 8 with a 2-minute or more rest between sets for four sets. Again, if we're trying to improve maximal or submax strength. If we're trying to grow muscle, so we're trying to improve hypertrophy, not the most important thing for distance runners, because more muscle mass means more energy expended to try and carry it around. But when someone comes in with an injury, a chronic injury, we often see a lot of muscle wastage and muscle deconditioning. So we see a muscle on one side smaller than the muscle on the other side. So we probably will have to try and give that muscle a stimulus to grow it back to the level of the other side where it should be, because a smaller muscle will, on the flip side, mean less, I suppose, capacity to handle those big forces. Now, in terms of frequency, if we're not rehabbing, if we're just training, doing strength training in order to improve performance, and we're fairly good from an injury point of view, twice a week is probably enough. And if we're racing you know, during the busy competition period, if we're racing quite regularly, once a week is probably enough to maintain it. But if we are rehabbing and overcoming an injury, we probably need to have that third in there for at least 4 to 6 weeks to try and front load those adaptations we're trying to get. So I'm just going to take you through a couple of video examples of common exercises and how we might progress them. So if someone hasn't squatted before, we're not going to put up 80 kilos on the shoulders and hope for the best. We're going to try and make sure their squat technique is good, put a chair on them so they can sit back on their heels and be able to squat smoothly, have good technique, and then we can increase weight. So if we get them to do like a goblet squat with a whole like dumbbell or kettlebell into their chest, and they know there's a chair on them, they can sit back on the heels and squat with good, and I suppose reinforce good patterns first. And then if we got that, then we can take the chair away. And if they're well coordinated and balanced, they can sit on their heels and be able to squat and maintain that sort of parallel torso and shin angle. And then we can move to a bar. So often we can, you know, if we're trying to introduce a deadlift, sometimes a hex bar can be a useful way to do that. It allows you to train with good technique in a safe way. So again, standing in the bar, less of a knee bend. So we're trying to keep the knees a bit stiffer to try and put more tension in the hamstrings. And we're trying to keep the back fairly straight as well. And then we move to the bar from the floor, or maybe from an elevated position on the right there. So again, trying to not bend the knees too much like a squat, trying to target the hamstrings a little bit more, keeping the back fairly straight as we lift. And we should feel the hamstrings and the glutes doing most of the work here. And then some of our single leg exercises, so a step up. So stepping onto a box. Ideally, if you can stay on one leg, hold that position for a second or two to show that we're balanced and back down nice and controlled. So really important, it's one of my kind of staple exercises, covers a lot of boxes. And we can do some sort of lunge variation or split squat variation. So an example here on the right of a Bulgarian split squat with a barbell, rear foot elevated, dipping down, not letting the knee travel too far forward. And again, we should feel this closer to the hip area. We shouldn't feel much pressure on the knee doing this. And we want to try and keep our back fairly straight as well. So calf strength, so I mentioned, if we bend the knee to about 90 degrees and have the foot slightly elevated, we can put a big load to the soleus muscle and target that. So doing seated calf raises. And also standing calf raises. So again, I like to go heavy in the calf raises. So Smith machine or leg press is an ideal way to do that. So standing with the leg fairly straight, pushing up onto the big toe, pausing at the top for a second or two, and back down slowly. And then plyometric exercises, some pogo hops on the spot, trying to be smooth in the ground, spend a bit more time in the air, progress to a drop jump. So again, bouncing off a box, that's a 30 centimeter box, trying to get off the ground in less than a quarter of a second and rebound almost as high as the box you jumped off. And then maybe doing single leg hops on the spot or single leg hops going forward, as you see there on the far right. So in terms of how this all fits in, we can split the season like a running program into 4 phases or whatever way you want to do it. So general prep phase, we're trying to prepare the body for the bigger running sessions that are going to come. So we're trying to improve tissue capacity, muscle capacity, 2 to 3 sessions per week, working on good movement patterns first. Maybe if we have certain weak spots, if we've had a previous calf or Achilles injury or an ankle injury, we'll do a lot of calf work. If we've had a previous knee or injury, we might do a lot of quad and hamstring and hip work. Or if we've had a previous hamstring injury or recent hamstring injury, we'll do a lot of hamstring and glute work as well. So again, that's the time to try and iron out those things so that you got good muscle capacity before the running training starts to get a lot more demanding. As you move towards specific preparation phase where your running starts to become more of a priority and you're increasing your distance, bringing in those key sessions, twice a week should be enough. We're not going to spend as much time in the gym or doing those exercises, so quality is important. So maybe a couple of exercises done really, really well at a good intensity. So we'll go heavy if that has enough training behind them. And we'll also bring in some plyometric exercises. And as we get close to competition, we want to try and keep that sharpness there, because traditionally that's where distance runners tend to sort of shelve the SSC program, because they're training for that marathon in 6 weeks' time. They're going to be tired from all the runs, but when they need to, it's probably the time when they need to get their most strongest. So if we don't train something for a period of 6 to 8 weeks, we can start to lose those qualities. So it's really important that we keep some of the strength training in there in a clever way, that keeps, I suppose, the week nice and balanced. So we still try and keep in 2 sessions a week, keep it short and intensive to keep that sort of stimulus and edge there. A bit more focus on the plyometrics, keeping in touch with our heavy lifts, And then when we are in season and competing, we try to maintain it one to two sessions a week. If we're racing it in a given week, one is probably enough earlier in the week, a little bit shorter than normal. If we're not racing on a given week, we can probably do a second top-up session. So in conclusion, most running injuries occur from the knee down. Our calf muscles in particular are probably the one muscle group that works close to its full capacity, even at slow running speeds, compared to quads and the hip muscles. So it's really important that we condition them for that. High intensity strength training. So I talked a lot about injury, but it's also associated with improved running economy and performance. And every runner has different needs. So, you know, I try not to, it's very hard to give a one size fits all answer to when someone has a question about a particular injury or what sort of strength training they should do. It's important that they come in, whoever, if they have a SSC coach close to them that's reputable and experienced, get a proper assessment and have their training SSC program prescribed to meet their individual needs. So hope you got something useful from that. I'm happy to take any questions, and I'll just give you a link there to some of my social media channels. I regularly try to share useful information, and always happy to take questions there as well. So thanks again for your attention, and yeah, happy to take questions.